Welcome to Healthcare Blind Spots. I'm Vivian Kopsinger-Birchall, your host, and my special guest is Dr. Subin Mattara, the Director of Projects and Facilities at the Hamdan bin Rashid Cancer Hospital in United Arab Emirates, Dubai to be specific. Welcome to the show, sir.
Thank you. Thank you so much. Thanks for the time.
So happy to have a cancer expert or a doctor or a healthcare professional in that part of the world. UAE is often not one of the countries that has a spotlight when it comes to fighting cancer. And so this is a great opportunity to learn about what you're doing or what the project is intended to address. So maybe to kick us off, can you tell us a little bit about yourself?
Yeah, definitely. First of all, thank you for this opportunity. And my background is being professionally, I'm an engineer, and my master's and research in sustainability. I'm not a medical doctor. I'm a PhD doctor. First of all, I would like to say that I'm in the healthcare facilities more than 8 years now. I started building universal hospitals and academic centers and ambulatory clinics, and now ended up with a comprehensive cancer hospital for Dubai. So that's it about my journey. And being a mechanical engineer by professions, in project management, engineering, procurement, and project management industries more than 18 plus years. And most of my career span is in Dubai, especially in the Emirate of Dubai, and some very hard couple of months and years in different Emirates in UAE itself. So last 18 years plus in this region. So that's me in brief.
Well, first of all, thank you for clarifying the doctor, PhD. That's, and the thing with healthcare, it's everyone in their different capacities has a big role to play.
Yeah,
that's engineering is definitely like the core, because without infrastructure, we don't have a healthcare system. But that with that background that you've just explained to us, can you tell us about the gaps in cancer care delivery in the United Arab Emirates that the Hamdan bin Rashid Cancer Hospital is aiming to address? And in the same light, how do cancer challenges in the United Arab Emirates inform the design and focus of the hospital you're trying to build?
Yeah, now first of all, if you're talking about the cancer journey in this region, we have a lot of private sector hospitals, and we have the government or public sector hospitals as well. However, the journey we are going to land it up with Hamdan bin Rashid Cancer Hospital. The uniqueness is that it's going to be a first comprehensive cancer hospital in this region, because it's not devoted for only one type of cancers, and it's having all kind of treatments are going to be under one umbrella for the diagnostics treatment, and including the radiology. So we have inpatient clinics, and in our facility we have almost 51 small clinics, which including the breast, prostate, etc., etc. And plus we have a fully equipped radiology department, and it's almost one complete floor for this entire big building. And we have an infusion gardens, because we have an infusion floors, because the cancer patients are mostly, they're spending a longer time for infusion. So just to make them calm and comfortable, and we have a unique architecture for this facility, facing towards to the infusion gardens, and infusion centers are located in level 3, and which is having a garden view, and we have outpatient clinics, and we have a VVIP clinics VVIP areas also. So mostly we have inpatient clinics and outpatient clinics, and outpatient clinics are in the lower level, and above levels are devoted for the inpatients. And plus, this particular facility is associated with a fully supported pathology department, and we have a research and academics facilities, and we are a part of a big academic health system. It is called Dubai Academic Health System. So that's also the part of it. So that's it's a very unique and big portfolios which we are going to offer to the public.
Right. And maybe one of the questions I should have led with cancer is like you mentioned it's more than it's not just one cancer. It's cancer. There are so many cancers. But in the UAE, what is the most prevalent or what are the most prevalent cancers that you have observed?
So, to be very honest with you, and this answer should come from our clinical team and feasibility team, and I cannot comment on it. But
Right.
what is the feasibility based on the project side, which I know is it's quite common the ratios among the breast cancer and the lung cancer and as well as the prostate cancers as well, and the least one is it's a pediatric because the pediatric cancers are less in numbers here and are more in numbers towards the lung cancer and breast cancer. So this is what in my general awareness I know because as I caveated in the beginning, I'm not a clinician but I'm an engineer. So from the facility side and expansion level and how I need to build a facility for the cancer center, that's my fundamental goal to achieve.
Which is a great segue into our next questions. From a facilities perspective, what are the blind spots that you think traditional hospital infrastructure often overlook when it comes to building facilities for cancer?
The first and formal thing when it comes for any hospital, the immediate thing is the ambience, and especially when it is coming for the cancer hospital, and it should be more patient friendly with the biophilic designs and everything. And in this region like Dubai, it's like a very very fast growing city, and the parking is a challenge for the patients to come and walk in for the appointments and everything. And most predominantly, we need to give a good facility for the future, which is more sustainable. And in our facility, we are focusing on more biophilic, devoted design. And according to me, we should try for most of our healthcare facilities to be sustainable and with more towards to the LEED accreditations. LEED is one of the accreditation for the sustainability, and in this region we are more lean to the LEED USGBC, but in different countries and we are having a different sustainable standard. So according to me, more leaned towards the sustainability is better for the healthcare sector.
Sure. How is this project being designed to accommodate the different cultures as in UAE, especially for the local residents?
Yeah, I think this particular project, this facility is open to all in the region, and it's not limited to the nationals, and which is welcoming to almost all the insurances, and the most brilliant thing is that, and which is coming under the umbrella of Dubai Health, and which is one of the largest academic health system in the public sector.
I just want to now tap into the technology. We are in an era where technology is influencing lots of sectors, especially the health sector. So in your project, what role does this technology play in construction and infrastructure of this hospital to ensure that it's efficient and it provides quality cancer care? And how does the hospital design incorporate all these best practices in cancer care infrastructure?
Yeah, this facility is fully developed with all the advanced integrated IT technologies and systems, and it's well captured with more advanced ICT technologies in terms of the IT systems as well as collaborated with the medical equipment interfacing to the facility systems and standards. So, which is more lean towards the IoT platforms, and we are comprehended with the digital twin model, And during the design process itself, we have implemented the BIM models, so that we'll be having a different LOD standards for design, starting with the pre-concept, which is having a LOD 200, and then it is going to the detailed design for LOD 300, and it will go to the construction stage, which is LOD 400, and finally to the facility operation stage, LOD 500. So this cycle of operations is strictly followed for the BIM model. So it is easy for us to transform to the digital twin model during the operation phase. So and the facility is fully equipped with with the remote asset management systems, and we are more more paperless friendly, and and it's with the full high tech standards of integrated IT standards in the region as well as international. And we have a lot of international partners, and here and there. So I cannot say the names here, and it will come in the later stage once the hospital is announced. So we are open to all the new technologies in the construction industries for this particular project. Plus, during the construction itself, we are implementing a lot of integrated models to have a remote progress monitoring systems, so that if I'm sitting in my office and I can track all the construction progress and even dashboards and where we are and what we are going to have next level of activities, etc. So that means, compared to the traditional monitoring progress and everything, we are trying to capture, to take the control with less manpower on top of it.
So I'm just curious, are there any particular challenges in trying to integrate all these advanced technologies during the construction process?
Yeah, the challenges are there, but we are bridging the challenges with the systematic protocols and process. So we have a strict governance system for the project management while it is coming to the design phase as well as to the construction phase. So we have a very devoted agenda of tasks to be oriented in each stages of the project, especially while coming to the design and construction.
And when do you
So the challenges always can be bridged, and we can't live without challenges, and we should live with that.
Absolutely. No, I completely agree. And then I guess thinking of the future, when do you hope to have this facility open to the public? And what is the arrangement for the public usage? Is it going to be open to everyone?
Yeah, as I mentioned, and it's going to be open to all the residents in Dubai and even in UAE, and it's not limited to any any kind of particular group, or it's not restricted to the nationals and non-nationals, and it's open to all. And it will work closely with the insurances and everything. It's a public facility, and it's going to be another flagship for Dubai for sure.
Yeah, now looking at global health from a global health perspective, what are some of the ways you think that collaborations can improve cancer care in the?
We have a different collaborations, as I mentioned, and we have a different collaborations from the Europe and from North America and domestically also. Our clinical structure is governed with full weightage of our local clinicians and international clinicians, and every stages of the design itself, all the clinical pathways and flows and even the facility guidelines and everything is to be vetted and reviewed by the clinical experts.
Dubai is beautiful. I can't wait to, first of all, see the progress of a comprehensive cancer center in this beautiful city. And maybe one open-ended question I have for you: is there anything that we haven't talked about that you'd like to tell our viewers about your project?
Like you said, and we all are excited to open this facility for this region, and we have wholeheartedly devoted all our efforts and time to make it happen.
Well, it's been such an honor to have you here, Dr. Subin, because like I mentioned earlier, not every time, not very often that we talk about the infrastructure part of healthcare in terms of the engineering and all that. So this is amazing. This is great. thank you for your time and for sharing your project with us.
Thank you. Thank you too. All the best.
And to our viewers, I hope you have learned about some of the amazing projects happening in Dubai, and we'll stay connected and maybe give you some more updates in the future. But for now, thank you for watching Healthcare Blind Spots. Till next time.
Thank you. Have a great day. Thank you so much.